Another sad story. Fortunately, we do a lot of sad stories, and again, we don't do these to, sensationalize them. I always try to make it as educational as possible, and obviously respect to people that get hurt in these things. But sad story out of Brazil that we're going to try to figure out what happened, and it is what caused the plastic surgery death of a prominent businesswoman in Brazil. So, yeah, she doesn't need plastic surgery. What's she do?
Beautiful.
She looks like a model. Wow.
Yeah.
So last week, a 31-year-old prominent businesswoman, Priscilla Dornelles, went to what was apparently a legit plastic surgery facility. And per the reports, she had liposuction, breast lift with implants, and a unnamed scar revision. She stayed at the facility overnight, which is a little weird. I mean, I wouldn't keep somebody overnight in a facility for that type of surgery. I mean, I do surgeries like that literally all the time. In fact, I wouldn't consider any of that to be, at least if it's what they say it is, like just, maybe liposuction on one area and the breast lift and breast implants, like that's not really big at all. And so, but they did keep her overnight. It also makes me wonder if maybe there's more to it since they did keep her overnight. I don't know. Maybe that's just common in Brazil. She was discharged the next day in reportedly good condition. Okay. Went home. The next morning, her sister came over to check on her because she hadn't heard from her, and they found her dead in her home. Now, we're going to dissect this, but I almost feel bad asking. I mean, do you guys have any theories on what may have happened to her? And that's like an unfair question to you guys because you guys do not admit. I'm just thinking, one of you guys heard me say enough stuff where you're like, maybe I do know what happened.
Maybe they left something inside, or
that would be hard. I mean, that's always a possibility.
Maybe they punctured like something where like her urine was like leaking out.
You got a puncture? Okay, now you're on the right track.
Something like that.
Yeah, puncture. That's definitely something we're going to talk about. I mean, I'm asking you an unfair question. It's like
I have no idea. Obviously.
Yeah. No.
And I just world. If we want to go back to that.
I just we do a lot of segments because I'll end up after you've been here a few years, you'll hear the same the same things over and over. All right, so. I'm trying to figure out what happened to this lady because it doesn't make sense on the face, right? Because you have what appears to be a healthy patient. So that's the first thing I would want to know when someone, passed away from surgery. Are they a healthy patient? Is it a 30-year-old seemingly healthy person, or is it a 90-year-old person with diabetes and cancer and all that? I mean, she seems very healthy. She looks like she's in great shape. So healthy patient. Next thing I know is what procedures they had, okay? Because the one procedure I hate, both of you can tell me what procedure. What procedure?
BBL.
Yeah, Brazilian butt lift, right?
BBL.
Yeah, absolutely.
Especially out of the country.
Thank you, Brenda. That's very good. Yeah, because of the high mortality rate associated with that. So what procedures did she have?
This one was in Brazil, right?
It was in Brazil.
Is she from Brazil, or did she go to?
No, she is from Brazil.
Okay.
Yeah, she's from Brazil. So it didn't say she had a Brazilian butt lift, but it did say she had liposuction. Now, I'm gonna circle back to this because did she really have a BBL? I mean, that would explain things. But let's just go with she had liposuction, breast lift, implant, and a scar revision. I mean, to me, none of those are very risky surgeries. I mean, I'm gonna break them down one by one. Scar revision, no. I mean,
I've had that.
Yeah, scar revision is nothing. I mean, that's like getting a mole removed. Breast lift with implants. Okay, a little bit more invasive surgery, but definitely very, very unlikely to result in something that would cause death. I just can't see that one. Now, liposuction is the one where there's a possibility. And I'm going to break down what type of complications it could be and see if we can come to a conclusion. So the other thing that I was going to mention is time after surgery. That is important. She apparently had some event approximately 24 hours after surgery. If it was an anesthesia complication, it would likely have been sooner. It would have been right after her surgery, which was not because she stayed in the facility. She was let go. So we can eliminate anesthesia complication for the most part, eliminate it. And that is definitely a risk of death after surgery. And the other thing is we can eliminate sepsis or infection, okay? Because it's too short.
Is sepsis like a longer, drawn out?
Yes, it's the infection. So sepsis is basically systemic infection. If you get an infection in one area, that's, an infection. If it spreads throughout your body, that's sepsis, okay? So we can eliminate sepsis because infections are most at risk at 2 to 10 days. an infection will come first and then sepsis. Like, you just don't generally jump into sepsis. Theoretically, it's possible, but that's not the normal pathway. So I'm going to safely eliminate anesthesia complication. I'm going to safely eliminate infection or sepsis because of the time frame. All right, so what could it have been? The first one that comes to mind is, did she have so much liposuction that she went into basically cardiac failure? That is a real thing. When we do liposuction, we limit liposuction to 5 liters, so 5,000 mLs. So that's basically what, a gallon and a third or whatever of fat removal, because when you do massive amounts of fat removal, it actually starts to strain the cardiac system as you start to get these massive fluid shifts. Okay.
Interesting.
Now, why am I eliminating that? Because it didn't mention how much that she had to remove. I'm eliminating it because in the picture, she's too thin to remove 5 liters.
Yeah.
Somebody that's getting 5 liters removed is going to be a heavy person, or obese even, because 5 liters is a lot. And so I think I can safely eliminate high volume liposuction just by looking at her picture. Okay, did she have a heart attack? I mean, that can happen. It can, but typically heart attacks after surgery are on people who are older.
Yeah.
People have cardiac issues. So, I mean, is it impossible? No.
Might have had an underlining.
That is possible.
It's like a big thing nowadays.
Underlying heart stuff?
Yeah.
You're not wrong. You're not wrong at all. I mean, that definitely could be a possibility. Is it likely? I would say no. Okay, bleeding. So could she have bled somewhere that could have caused enough blood loss for her to die? She could. That is a possibility. I mean, you mentioned it. You were talking about, you were dancing around it, which is the liposuction punctured something. That is a possibility for sure. If the, I don't think...
In liposuction, can you nick like where your secretion would come out? Because that's what I was thinking, is not so much blood, but like, because you could die faster with that, right?
Well, and that kind of goes back to, could it be sepsis? I mean, the only way it could have been sepsis is if the liposuction punctured the abdominal wall and it maybe punctured the colon, which would release a lot of, bacteria into the abdominal cavity, and then she got sepsis and died. Okay, that's a possibility. But the reason I would say...
That takes like a couple days.
Well, that could actually go pretty quick.
Oh, okay.
That's almost like, if you ever heard of people lose appendix rupture and they die, that happens fast.
Yeah.
And they can go down very quickly. But if that were true, I think that would have popped up before she left the next day.
Okay.
If she punctured her colon, she maybe could have gotten out of the facility, but she would have been an extreme problem within hours.
Okay.
And she was there overnight. So now maybe like a slow bleed, I mean, possible. The time frame is what really makes this weird, because she was monitored for basically 12 hours and she was fine, and then she was dead within an hour. Organ injury is the other one, and that goes along with the puncture and the bleeding. Liposuction can puncture organs. I mean, it's even possible with the breast. If you had a big needle and you were making a stitch, could you nick the lining of the lung and cause the lung to collapse? I mean, anything's possible. That's not a that's not a complication I would talk about if somebody comes in for breast surgery.
But you would know that before you left, right?
Probably. Yeah, probably. That's, again, what makes this one weird is the time frame. She was monitored for at least 12 hours after surgery and was fine, according to them, and then suddenly she's dead. And it just doesn't make sense. The other one that it could be would be a blood clot. Mm-hmm. When you look at what are the most common causes of surgery death, blood clot is generally number 2. Again, that one's weird because that usually happens 2 to 10 days after surgery. She wasn't really 2 days out when this happened. She was 1, so could it be a blood clot? And what happened?
When did her sister come over to check on her?
So she had surgery on we'll call it day 0. She was discharged home.
Day 1.
Day 1.
24 hours.
And she was dead the morning of day 2.
Okay.
Yeah, it's a really narrow window.
It is.
It's really narrow. The other alternative I have, which the time frame would actually follow this, is if she had a Brazilian butt lift, fat embolism can happen in that 1 to 2 day period. Now, They didn't mention she had a Brazilian butt lift, but they did mention she had liposuction. And sometimes when these reporters are like getting information,
Yeah.
you know, maybe it wasn't actually described the right way. So if I had to pick one of these, and it's almost like I'm cheating, I'm saying, well, based on the information I have, the information is not right. You know, I'm saying that something's not right here.
Something isn't adding up.
Something isn't adding up. Yeah, I do think that something is not adding up. I think that common things are common. Far away, the most common deaths of plastic surgery, at least in this day and age, is fat embolism. The most common surgery is Brazilian butt lift, which does require liposuction. I mean, that's my guess. You know, I don't know.
I think you might be right on that.
I'm going to have to follow up on this one because it's weird. I mean, you know, I mean, anything's possible when you have surgery. It's like flying, right?
Yeah.
You know, I mean, if you tried to be in a plane crash in your entire life and flew every day, we did the
Yeah,
we did the
we
wrist
did the
thing on it.
stats.
It's impossible. But anything's possible. There's always that very, very minimal risk. And so all those things I talked about, like heart attack, blood clot, you know, this and that, is it possible? Sure. Is it likely? No. So I don't know with this one. It's hard for me to give people any advice about this because this is a woman who did not do medical tourism. She went to a legitimate facility, you know, nearby where she lives. She didn't have any, at least by what they're saying, she didn't have any crazy surgeries.
Yeah.
You know, breast lift and implants and lipo, I literally do that all the time.
Yeah.
And it's so routine. And she's young and she's healthy, and then suddenly something happens and she passes away, and it just, none of it makes
awful.
sense. Yeah.
Yeah.
So I'm gonna keep a follow up on this one because I just feel like we're missing something in this.
I think so too.
Yeah. So.